Hey y'all, thank y'all for clicking on this video because I have a beautiful birth story to share with you today. I don't typically share this type of content where I'm sharing other people's stories on my channel. However, this one is so beautiful. I want everyone to hear it. It's something everyone needs to hear about as well. So I've shared lots about birth back when I was pregnant with Eliza. I've shared my 3 birth stories, my traumatic hospital birth, and my 2 home births. Audrey is going to share with you today in this video her birth story. She filmed this for Instagram and I asked her, could I please share it here on YouTube, because I just wanted more people to see it. So you're gonna see it in Instagram vertical video format. She had a beautiful birth, traumatic parts, beautiful parts. All birth is beautiful, but this is something that no mama should have to go through and was completely avoidable. So I want y'all to listen to Audrey's story. She is a local Mississippi mama friend. You can truly feel her emotions in this video, but her passion for sharing this with the world so that no other women, no other mamas have to face this. So here is Audrey. I hope you enjoy hearing her birth story.
This is my story, I guess, of my traumatic birth experience. Y'all are gonna have to bear with me. This has taken me a long time to make. Just bear with me. This might be a long video. My main goal is just please share this with pregnant people, people who plan to be pregnant, anybody you know who is a female. Just share this, please. I feel like this happened to me and I'm supposed to advocate for it. So just help me get the word out about this, please. Little backstory, for those of you who don't know, I have a 2-year-old daughter. Her name is Liliana, and I was induced with her. I'd also got the epidural with her, but besides that, she was a perfect, healthy baby girl, and I was perfectly healthy as well. Second pregnancy, I opted for a more natural approach. I didn't want the epidural. I didn't want to be induced. My doctor knew about this. Well, she was a midwife. My midwife knew about this. I just can't say her name. We're not going to say her name, obviously. My midwife knew about this. We had gone over my birth plan. Everything was good. Pretty much I just told her I wanted to labor at home as much as possible. And then, you know, come in. I don't really want to be hooked up. I got a hep lock. I don't plan on getting any pain medication. And, you know, just have as natural as possible in a hospital birth. That is exactly what I got. Literally, my labor could not have gone more perfect in how I wanted it. I started having contractions around 10, and they got really strong really fast. Went to the hospital around 12, 6 centimeters dilated, labored in the hospital for like a couple hours, and had Vivian at like 3:33 a.m. So it was a very short labor. It was perfect, and I didn't tear. Gave birth to a beautiful, healthy 7 pound 6 ounce baby girl. I was so proud of what I had just done and everything that my body just did. And it was just perfect. It was so blissful, and I was so excited, and the pain was finally over, and it was just so worth it. I had my baby in my arms. So my midwife actually didn't make it to the birth. I ended up using the hospitalist OB on call. She didn't make it in time because I guess they just didn't think I was going to progress that fast, but I progressed really fast, and she didn't make it on time. She actually got there like 3 minutes after Vivian was born, and the OB who was on call, who delivered Vivian, let my midwife take over. So at this point, like, Vivian was already born. OB said, okay, I'll leave it, you know, you're here now, you can take over and deliver the placenta. Like I said, everything was just perfect. It was just a dream up until my midwife walked into the room. So at that point, it's all bliss. Moms know how it is. People are taking pictures. It was just me and my mom and Tyler taking pictures. I'm breastfeeding her for the first time. And she's like, all right, we're going to get ready to deliver your placenta. Like, literally just a couple of minutes at this point since I've had Vivian. She walks in. She applies gentle traction to the cord, and she realizes that my placenta is not ready to come out. I'm nursing, which is what naturally helps the placenta come out. So then she's like, oh, it's not ready. Waits maybe 15 seconds, maybe. Tries again. Tries to pull gently. Doesn't come out. It's not ready. At this point, I'm not even paying attention. Nobody's really paying attention. We're all, you know, in the bliss. We're looking at the baby. Oh, it's not ready. Okay, that's fine. Waits maybe another 30 seconds. I'll give her 30 seconds. It probably wasn't even that. And she tries again. But this time, she wraps her hand around my cord and she pulls on my cord as hard as she can and is applying fundal pressure and is telling me to push, 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 push. Keep in mind, I just pushed out a 7-pound, 6-ounce baby. So if you're sitting there telling me to push, 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 I'm fixing to push, you know? Like, I was pushing hard. And she was saying, push, 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 hand wrapped around my cord and pulling as hard as she can with all of her might. That is when my placenta comes out with my uterus still attached. 9 minutes. This is what the medical records say. 9 minutes after I had Vivian, she pulled my placenta out. 9 minutes. What was the rush? Why couldn't she just wait and let my body do what it was supposed to do? First off, I'll tell you, it was 3:30 in the morning. She doesn't live around here. She was ready to get back home and get in bed. It was, 2 days before Christmas? Wait, just 2 or 3 days, whatever. 3 days before Christmas, she was ready to get home and get in bed. She was ticked because she didn't just make the money off of the birth, the OB on call did, because whoever delivers the baby is who makes the money. So she was ready to hurry up and get home. Didn't want to wait on my body to do what it naturally needed to do, which it would have done. Like, whose placenta doesn't come out? Anyway, so after she yanks my uterus out, let me just side note. This is the most pain that I had ever been in. Like, it's like undescribable. And I just had a natural birth with a 7-pound, 6-ounce baby. I was 120 pounds at birth, and I'm usually like 90 pounds. And the pain that I felt when she was ripping my uterus out is undescribable pain. They had to take the baby from me, obviously. The process of her pulling on the cord, somebody had to grab her from me because I was screaming in pain. There's a lot of details that I'm going to forget and not be able to say, but the pain was just unlike anything I've ever felt in my life. Keep in mind, I had no pain medication at all. This was all. I felt everything. So once she pulls my placenta out, the first thing she says is, "Oh, wow, that's a really big placenta." And then she says, "Oh, wait, it's her uterus." So I was like, "What?" And I start looking around, and all the nurses look like ghosts. Like, their faces are just like, I look at my mom, and my mom's usually the one to be like, "You're fine, you're fine, you're fine, you're fine, you're fine." You know, but I look at my mom, and she turned away from me and was kind of doing like this. And that's when I knew. I was like, what the heck did she just do? So I start crashing, obviously. My blood pressure was 40/20s, and I just remember feeling really fuzzy and really confused. I wasn't getting a lot of answers because at this point she was like, get the OB back in here immediately, you know, we've got to rush her into surgery. And she hopped on top and they rushed me off to surgery. All I was worried about was my baby. Obviously, is my baby okay? Is my baby okay? Felt robbed from the whole bonding experience, obviously, but that's a whole nother thing. Anyway, get me in the OR. They have no idea what they're doing because uterine inversions are extremely rare. They don't happen a lot. I think all the doctors had either said they've never seen it before or they've seen like one in their whole career. Very rare. So they didn't really know what they were doing, and it was 3 a.m. A couple days before Christmas. So we had to wait for the anesthesiologist the whole time I'm in the ER, and they're just trying to keep me awake. And I stayed awake. I don't know how, but I think I was just worried about the baby. She was fine, but that's just what I was like. I want my baby. Where's my baby? Is everything okay? And so it took them a long time to get me prepped for surgery and to get the anesthesiologist to get there. Time I was just praying. I just remember asking Jesus, please do not leave these 2 babies on this earth without me. Just praying that they would still have a mom, that I would make it through this, Lord, please. I couldn't tell you anything else that happened after that, except for I woke up in the hospital room in tremendous amount of pain. They were able to put my uterus back in. I think it took them a couple tries. I've read all the medical records or whatever. It took them a couple tries. They got it back in finally, and it like perked back up my uterus because it was just flaccid and just no good. But they finally got it back in. Humongous, hideous vertical scar on my abdomen now, which doesn't even matter. But it's just I get back in my hospital room. I'm in tons of pain. I'm missing out on the bonding with my baby. I'm so weak. I can't hold her. Like nothing works. I don't remember my platelet counts, but like they had a hard time getting them back up. I had to stay in the hospital for several days. It was the most challenging thing. This whole experience was the most hardest thing I've ever been through in my life. I was so weak. I could not like sit up without feeling like I was going to pass out and throw up. I had to get 4 units of blood in the OR and 2 units of platelets. I was obviously hemorrhaging. Recovery was so hard. It was, it took forever. Probably like 8 weeks until I felt 100% no pain. It took a really long time to not feel any pain. I couldn't walk. I had to take at-home therapy. So many things, like there's so many details and so many things that happened. It was just crazy, and it's like something I'm never gonna forget. I also won't forget how my doctor didn't reach out to me. I was in the hospital on Christmas missing it with my toddler, and could barely hold my newborn, and my midwife who did this to me didn't even reach out to me. I had to message her on Facebook to get her to give me a referral to PT for at-home PT because I could not walk after this surgery. I'm not sure I think it was from like nerve shock. When they sprawled me out on the OR table, my hip flexors were not wanting to work and I couldn't walk. So I was having to use a walker and had to have 5 weeks of at-home physical therapy. So y'all can imagine how that was too. Like I couldn't walk around and hold my baby, much less my toddler. I couldn't hold Liliana till like 8 weeks. I didn't hold her till 8 weeks after having Vivian, but I couldn't hold Vivian either. And the whole situation was just extremely traumatic and 100% avoidable. The common practice is gentle traction on the cord to try and get the placenta delivered. A lot of midwives, OBGYNs will apply gentle traction. I personally don't think they need to be touching anybody's cord at all. Our bodies know what they're doing. God designed our bodies perfectly and know exactly what to do. But my doctor, my midwife, applied gentle traction twice. The third time, she pulled as hard as she could and my uterus fell out. I vividly remember her wrapping her hand around my cord. I will never get that image out of my head. Ladies, this goes to say, do not let your provider, OB, midwife, touch your cord. Do not let them pull on your cord because this can happen to you. If you look up on Google, a quick Google search, what causes a uterine inversion, it'll tell you. Pulling on too much traction on the umbilical cord. Do not let your doctor pull on your cord. I'm gonna put some pictures, kind of the journey and everything, because like I said, it was like an 8-week process. This took a long time for me to get better, and I still have days too where certain things are going on, and I have some pain. I'm still not 100% better. I've been to a different doctor. I haven't been confirmed whether or not I can necessarily have kids. They've told me, at first I almost had to get a hysterectomy in the OR. I'm leaving out details. It's hard to remember everything, but at first they thought I was going to have a hysterectomy. Well, first they thought I wasn't going to make it. Then they were like, okay, she's probably going to have a hysterectomy. Thank gosh I didn't have to have a hysterectomy. And then it was, well, she's probably not going to be able to have any more kids. And then after looking, we did some research because like I said, this is rare and nobody had really seen it at the hospital. Okay, it looks like you're going to be able to have kids. Haven't been told a definite yes or no, which of course I'm so traumatized by this event. I don't even know how I feel about that situation, which is honestly really sad because before all of this, obviously I wanted more kids, but everything that I'd been through and how traumatizing it was for me, I can't even begin to fathom that right now. Anyway, moral of the story is please do not let your provider pull on your cord. Do not let them touch your cord. This is kind of like the trigger warning because I'm going to post some images of everything. So